Hi, my name is Elizabeth Platt. I'm the Director of the Policy Research Technology Program at the Center for Public Health Law Research at the Temple University Beasley School of Law. Thank you for joining me today. I will be presenting on our creation of a policy analysis platform to study the impact of laws on public health, what we refer to as the Health Outcomes and Policy Evaluation Platform, also known as HOPE for short. First, I have no relationships to disclose. Of note, HOPE was originally funded by the National Institute on Drug Abuse. The HOPE platform was designed to serve as a research-friendly website that facilitates first, open science principles of access to raw data, analytic transparency, and access to analysis. Second, it provides integrated computational functionality for analysis in major statistical programming languages directly within the platform. Lastly, HOPE creates a data science environment centered primarily on health policy, unlike other open source data projects. By way of background, at the Center for Public Health Law Research, we support the widespread adoption of scientific tools and methods for mapping and evaluating the impact of law on health. We do legal epidemiology, which is the scientific study and deployment of law as a factor in population health. This provides an innovative framework to understanding the effects of policy changes on health. At our center, our team of lawyers use policy surveillance methods of legal epidemiology to turn the text of law into numeric legal data. This legal data can be analyzed alongside outcome data to study the impact of legal interventions on public health. But once you have the legal data, you still need a platform to help you do this more efficiently. Through our work, we saw a big need for the streamlining of such legal data analysis. Traditional methods often require researchers to download, clean, merge, and then finally analyze the data findings. Traditional methods also disincentivize transparency and tend to frustrate the ease of replicability, ultimately leading to data hoarding, while often not providing a clear method for assessing the credibility of sources. These are just a few of the pain points that led us to want to build the HOPE platform. Our team of lawyers and software developers work together to build the platform, which includes cloud storage for all of the data stored on the site, distributed cloud architecture to spread the storage across multiple servers, which includes containerized virtual machine technologies for that storage. And lastly, a layer of credibility and rating features directly on the site itself so that users can assess the sources of data uploaded to the site. We worked with an external group to implement human-centered design principles when building out the user interface. This involves several rounds of wireframing interactive websites and presenting the mock-ups to other research groups, past collaborators, and other parties we felt might find the platform useful. Once it was built, our external partner conducted a test analysis, constructing an analytical model using our existing opioid policy data and existing outcome data on drug overdose deaths from the CDC Wonder database to assess the impact of key state legal interventions on the opioid epidemic. This report found that the states with high balance of policies, including Good Samaritan drug overdose laws, naloxone access laws, medication-assisted treatment laws, prescription drug monitoring programs, and comprehensive medical marijuana programs experienced a reduced number of overdose deaths by at least the second year of each respective legal intervention. This analytical model, as well as additional legal data from our prescription drug abuse policy system, is publicly available for further analysis on the HOPE website at hope.monocle.com. Users can download the legal datasets directly from HOPE, but also see how other users have rated things like data quality, data cleanliness, data limitations, and other credibility factors raised by other viewers. Users are also able to click on a particular data set and run that data for further analysis using Python or R alongside their outcome data, displaying this analysis in a Jupyter notebook. Users can then publish and share their analysis code directly on Hope so that other researchers do not need to recreate the wheel. Other users are able to fork the existing analysis or reuse with their own modifications for their own analysis. In terms of next steps, we're looking to improve the user interface to make it easier to navigate while adding in more training documents on its intended use. We're also working with additional researchers from Temple University to explore other uses of the Hope platform by extending it into a data sharing platform that can be used not only by researchers, but also interested clinicians and their patients. We're also exploring additional integrations with other research tools, including Google Collaboratory. And lastly, we will be looking to work with collaborators to seed the platform with more data. This will help us build a community of practice for legal epidemiology and policy research, and to hopefully make better science available faster for all. If you're interested in seeing more of the Hope platform, please visit hope.monocle.com and feel free to email me with any questions at elizabeth.platt@temple.edu. Thank you.